So today I'm going to be talking about CKD in cats, and CKD stands for chronic kidney disease. So what is the function of the kidney? Well, the kidneys are two really important organs that are in your body. Well, there's one organ, but there's two of them. And they have many different functions. Some functions are blood filtration, producing urine, producing the hormones angiotensin, calcitrol, and also producing erythroproteins. It also stimulates bone marrow to make more red blood cells, and it helps manage blood pressure. So when the kidneys aren't functioning properly, all of these functions do not work correctly in the body, and it can cause the cat or any animal that has CKD to be unhealthy and very sick. And chronic kidney disease is the loss of kidney function over time, which can result in some of these problems that I will describe later. So what are the causes? Most causes of CKD are idiopathic, meaning it is unknown. You can take biopsies from the affected kidneys to show the changes in inflammation and of the structures, but it doesn't necessarily tell you the cause. But there are some well-recognized causes, such as kidney tumors, which could be a lymphoma, or bacterial infections, or even toxins, such as like certain drugs, can damage the kidneys permanently and then cause the animal to have chronic kidney disease for the rest of their life. So some signs and symptoms. The kidneys usually filter out all of the waste products from the body and take it out of the bloodstream and then put it in the urine to be excreted. Obviously, when they're not working correctly, that is very hard to do. So you get a buildup of waste products in the bloodstream. The animal may seem lethargic. There is also an increased urine output, but it's usually urine that's mainly just water, or they're pushing out a lot of the proteins that their body should be keeping because the liver is not taking those out of the urea properly, so it's getting passed out through the urine. They also may experience a loss of appetite, which could also result in weight loss. They could have an increased thirst and water consumption because they'll be putting out so much water, they'll get dehydrated. And they could also experience blood acidification, also known as acidosis, due to the molecules being left in the bloodstream. There are also some secondary symptoms which I've seen, such as blindness, and this is actually caused because of hypertension, which is an increased blood pressure in the body, and that is also as I said, a secondary sign of CKD. Matted fur in an unkept coat is something that we have seen in a lot of CKD patients over the summer. When I was interning, we saw at least 3 cats, and they all had very thick mats all across their back, and they usually have really nice coats. So that is a sign to look for it, and we saw many connections between that and CKD. Also, excessive skin tenting, which is when you pull on their skin. It's to test for dehydration and dry gums. And then also anemia, because erythroprotein is produced by the kidney, which helps produce red blood cells. So if the red blood cell count is low, that can be due to the kidney not functioning properly. So the diagnosis. Usually you do a blood test and a urinalysis. The blood test is looking for 2 important waste products, which is the blood urea nitrogen, also termed the BUN, and creatinine. So the blood urea nitrogen is produced when your liver is producing ammonia, and that contains nitrogen. And after it breaks down proteins used by your body cells, this nitrogen is combined with other elements, and that is put into urea, or makes up urea, which is in your bloodstream, and then that travels to your kidney. And if the kidney is not functioning properly, the urea is left behind, and it causes the blood urea nitrogen content to be very high. So if you see a high BUN, that is usually linked to CKD. And also creatinine, it's formed by creatine, which is a molecule used by your muscles. And high levels of creatinine indicate improper renal function. And that has just been linked over time. In a urinalysis, you look for the pH in the urine and the presence of proteins, blood cells, and bacteria, as well as other molecules that aren't necessarily supposed to be in the urine. And this can be done by a cystocentesis, cysto meaning bladder, and centesis is a process where you use a hollow needle to extract a fluid. So that's what you do. It's a very thin needle that you can use to puncture the bladder and get out a urine sample, because especially in cats, it's very hard to collect a urine sample You can also use, I think there's certain types of litter that don't absorb the urine, they just trap it, so then you can get a urine sample from that, but there is some more issues with that, so cystocentesis is usually easier. And you also can look at the glomerular filtration rate, and so basically each kidney has millions of small blood filtering units called nephrons, and these nephrons constantly filter the blood through tiny clusters of blood vessels known as glomuli. Sorry, glomuli. It's a tongue twister, but basically if the glomerular filtration rate is low, that is just meaning that there could be a problem in the glomuli because they're not filtering things out correctly. There is also a new test called the SDMA, which is symmetric dimethylarginine, which is a waste product of metabolism, and this has been known to indicate CKD earlier than other blood tests. It's not very widely used yet, but it is very promising because it can catch it a lot earlier. And also diagnostic imaging, such as x-rays and ultrasounds, are used to show the changes in shape and size and functions of the kidneys, which are all very helpful to see how far along the CKD has progressed. So treatment. There is no specific cure for CKD, so all the steps that are taken are used to improve and prolong their quality of life. Hypertension or the high blood pressure can be controlled by oral medications. To reduce the urine protein loss, angiotensin enzyme inhibitors can be used. One thing that has been a big help in most animals has been to change their diet and put them on a diet that has either increased water or a low concentration of proteins, phosphorus, sodium, and high concentrations of fat-soluble vitamins such as A, D, and K, and also high fiber. And those have been the most effective at prolonging the cat's life. Also, erythropoietin replacement therapy has helped a lot because a lot of the patients are anemic, and erythropoietin makes red blood cells, so that's very helpful. And fluids can also help counteract dehydration. And so the cost of this, the median cost is around $1,400, and the high cost is around $2,400, and that obviously varies on the type of treatment that you decide to choose. There are lots of different treatments as I described, but usually a blood test and urinalysis are the most common, and you do that at like a physical exam by a veterinarian. Depending on how far you're willing to go, there have been some like alkaline treatments or even like organ transplant, but those are on the more aggressive side of treatment. So most people will most likely spend around $1,400, and that's usually just for the whole cost of diet and any medications orally or fluids, which have been proven to help. And then I think that's just my sources.
Okay. Questions, comments?
For sure. So my dog, who has since passed away from renal failure, when he was going through it, at least before we started any treatment, he was like on the brink of death. The thing that we did for the treatment was actually relatively non-invasive on the other ways you can do, where we essentially did fluid treatment every day for a period of about 3 months, and then spaced it out as time went along. And with the changing diet, we got him to about a year and a half longer. I think at least the cost for us was probably under about $1,000 or so. But at least so as long as you catch it relatively early, it was pretty much a non-issue.
I got a question. Now, when does this show up on average for a cat?
On average for a cat, when I was researching, this typically occurred in older cats.
Okay.
It can occur in younger cats, but it really just depends. My cat suffered from CKD. She was 10, which isn't too old for cats, but
right. But at least that's halfway through life. Because I had some friends had a Mastiff and they bought it, and I guess that was diagnosed with congenital renal failure, and they thought it was because of the breeding. You know, the breeders were maybe pumping out too many dogs and weren't worried about the past offspring having things, and so I think they had to euthanize it at, I'm going to say like 2 years of age. You know, it was there from the time of birth, but it wasn't fully developed, you know, it's over time. And I think they call that congenital renal failure. And so so it sounds like a little different than chronic
Mhm.
renal failure. But I mean, it was pretty sad. It was a beautiful dog, but then about 2 years of age, it was just not working. There was nothing really could help it. Now, if you're not familiar with tenting, you pick up a loose area on the integument in the skin, and if the animal is fully hydrated, that tent that you make will disappear relatively quickly. If you make a tent and it stays, then that's dehydration, and then there's stages in between there. And Ethan, how did you give your dog fluid therapy?
So all of that was sub-Q.
Sub-Q, that's what I was gonna ask. What kind of fluid was it? Was it water or saline?
It was saline. It was a
Saline.
lactated ringer.
Okay, lactated ringers, okay. Okay, we'll go to our third one, which I will find.